USMLE Step 2 CK Oncology Part 6. Topics: Waldenstrom, Macroglobulinemia, and benign monoclonal gammopathy, also called monoclonal gammopathy of uncertain significance. Waldenstrom macroglobulinemia, also call it lymphoplasmacytic lymphoma. Lymphoplasmacytic lymphoma. This is a neoplastic cell called plasmacytoid lymphocyte. This is a conic plasma cell neoplasm. Produce the monoclonal IgM protein which cause cryoglobulinemia. Increase production of IgM. So plasmacytoid lymphocyte produced in the lymph node and infiltrate the blood. Massive IgM production cause hyperviscosity. Very important to distinguish from the multiple myeloma from the Waldenstrom macroglobulinemia. Multiple myeloma does not have very high hyperviscosity compared to the Waldenstrom macroglobulinemia. Patient could have night sweat, confusion, change mental status, hemorrhage, retinal vascular dilation, and tortuous can cause blindness, visual problem due to the blood vessel angles in the eye. Platelet dysfunction cause mucosal bleeding. Patient may complain of headache and dizziness, difficult to walk, and also complain of the weakness, numbness in the leg, vertigo, Raynaud phenomena. Bone marrow, mild anemia, probably mild leukopenia, mild thrombocytopenia, splenomegaly, enlargement of the liver, lymph node. Develop generalized lymphadenopathy. Patient may complain of pain all over the body due to the massive infiltration of the plasma cell and its product IgM all over the body, which cause the demyelinating sensorimotor neuropathy. Physical exam. Vital sign could be normal limit. And compared to the polycythemia vera, when blood pressure will be increased. Neurological test: loose sensation in the extremity, hepatosplenomegaly, lymphadenopathy, ophthalmoscopy, dilated tortuous segmental retinal vein due to hyperviscosity, bruise due to the platelet dysfunction. Diagnosis: urine analysis. 10% of the Waldenstrom macroglobulinemia patient has Ben-zone protein, and almost all patients of the multiple myeloma has Ben-zone protein, but Waldenstrom macroglobulinemia probably have 10% of the patient has Ben-zone protein. Serum protein electrophoresis, IgM spike, Ben-zone protein, which cause the hyperviscosity. These two confirm diagnosis. Excess amount of IgM antibody in the blood. X-ray, no bone lesion, but multiple myeloma has bone lesion. Low hemoglobin, hematocrit, low platelet. White blood cell could be normal. Treatment: if you have hyperviscosity, to plasmapheresis. To decrease the production of the IgM, give chlorambucil or fludarabine, and if it doesn't work, can add prednisone with these two drugs for long time management. These two drugs would control cells that make abnormal immunoglobulin and decrease production of the immunoglobulin. So Multiple myeloma rarely can have hyperviscosity, but Waldenstrom macroglobulinemia has viscosity. Multiple myeloma has high rate of Benign protein, and the Waldenstrom macroglobulinemia does not have that much possibility to develop Benign protein. Multiple myeloma has lytic bone lesion. Waldenstrom macroglobulinemia does not have lytic bone lesion. So X-ray will be normal. Next topic is benign monoclonal gammopathy. Monoclonal gammopathy of uncertain significance. In regular examination, serum test for the immunoglobulin accidentally found that all patient has increased number of the immunoglobulin, IgM elevation for example, but no other health problem. Compared to the multiple myeloma, benign monoclonal gammopathy has a small number of plasma cells. Patient has no symptom or mild symptom. If IgM elevated, no other protein is elevated, which may cause the increase the serum protein electrophoresis. Urine dipstick is negative. Urine protein electrophoresis does not show the increase of the monoclonal protein, so no Benign protein in the urine. Serum test by serum protein electrophoresis may find IgM or IgG, IgM or IgA elevation. All other serum tests are normal. After do the serum protein electrophoresis and find that etho spike, do bone marrow biopsy to rule out multiple myeloma. Very important, rule out multiple myeloma to the bone marrow biopsy. And if plasma cell less than 10%, patient doesn't have multiple myeloma. Multiple myeloma has greater than 10% of the plasma cell. And this patient does not have renal insufficiency, lytic bone lesion, anemia. So there is no treatment but follow up this patient, and anytime has any symptom, patient should come to the medical office for ask for should seek the medical attention. And complication, this patient has high risk to develop multiple myeloma in the future, so this patient should be follow up.